let me try to do this. World War II. The Nazi armies overrun Scandinavia. And they take all the livestock and feed it to the soldiers. And the local population becomes healthy. Now that was not, the Nazis were not public health advocates. But that's what happened. Diabetes dropped way down. Heart disease dropped way down. High blood pressure dropped way down. Overweight dropped way down. And people said, well, it's just a fluke. And they said, well, let's wait and see what happens after the war. When this war is over, we should take a look at this. As people return back to their normal, usual lifestyle, with the livestock and so on, what would happen then? And guess what happened? 10 years later, the diseases were back. We never learned our lesson. Here's Dr. James Anderson from the University of Kentucky. I mentioned him earlier to you. He took 28 patients on insulin, and what he did, he gave them a high fiber, a high starch diet. Unrefined starch. And very, very low fat, 10%. He was inspired by Nathan Pritikin, who also worked for the 10% fat diet. And I happened to be there as the director of research and education at the time. So I met Dr. Anderson, and we had good discussions there. And he said, Hans, let me try it out at the University of Kentucky and see what happens there. So he took 28 diabetic patients on insulin, and he gave them a high fiber, a high starch, a very low fat diet, basically vegetarian, vegan diet. And here you see the results. 22 out of the 28 patients had to have the insulin removed within 3 weeks. Think about this. This has been done over and over again. Here's the Pritikin program. 74% of the patients with type 2 diabetes on oral drugs left the center free of any diabetes medication. They were new people. And all they did, they exercised every day. They became inspired by understanding the disease. They learned how to prepare simpler foods, healthier foods, and they began to enjoy the foods. It just takes about 2 to 3 weeks to get used to the food. You make the taste adjustments. It happens very nicely, very easily, and 6 months later, as you follow this lifestyle, you cannot stand it to have these hyper-palatable foods that we're all addicted to. All of a sudden, the Snicker bars no longer has the appeal because something has happened. The cerebral phase, the cognitive phase has changed. You interpret these kind of things. The taste is interpreted differently because of what you know. And so the answer to these chronic diseases has to be found in education, motivation, understanding, and provided with social support so we can help each other until we're strong enough to face the world and the culture. Are you with me? I was in Australia. I met Dr. Karen O'Dea. And she said, Hans, we did an interesting experiment. We looked at some Aboriginal people. They're usually on a very simple diet, but then they come to Sydney, and over the next 10, 20 years, many of them turn into diabetics. So we picked 10 diabetics. They used to be in the outback before, but now they had become civilized Australians. They were eating like Australians, and they had developed diabetes. And he said, I sent them back to where they used to live. And I said, whatever you find, you eat it, it's yours. So they began to eat kangaroo meat, which is only 13% fat. The American sirloin steak is about 70%. So this is a very low-fat kangaroo, meat that they picked up there. But they also were eating roots, high-starch foods, and berries, and fruits. They were diabetics. They ate fruits and roots and kangaroos. And within 7 weeks, their insulin normalized and their blood sugars dropped dramatically. 7 out of 10 of these new civilized diabetics no longer had to worry about being diabetics, as long as they followed a very simple diet. When you're diabetic and you have now a reversibility, it doesn't mean that you can do anything from now on. No, you've got to stay on the program for life. Otherwise, it doesn't. You lose the benefits, obviously. Here's Dr. Neil Barnard, excellent work. He, again, used a very simple diet. Foods has grown, whole foods, and 71% of his diabetic patients were able to stop their pills in his 26-day program. Here's the results from our program that we did 2 years ago, the randomized controlled trial that I talked to you about. This is all within 12 weeks. Because of the reduction in hemoglobin A1C, because of the reduction in blood sugars, these people, on average, there are 44 in this group, their nerve damage risk declined by 67%. Their vision loss, going blind, the chance of going blind was reduced by 67%. The likelihood of developing kidney disease reduced again by 67%. The chances of an amputation for these diabetics was reduced by 77%. And diabetes-related death reduced by 38%. Just think about this. This is 12 weeks, and you dramatically lower the likelihood of all these complications that are life-threatening. What do these diets all have in common that are identified as being involved in the reversibility of diabetes type 2? Well, aside from the exercise that we recommend, here's a dietary thing. You want to use a diet that is plant-based, it's whole food oriented. Which means that it should be very low in fat. Because a plant-based diet is usually low in fat, unless you add a lot of oils and so on to it. You want to perhaps not go as low as some people do say, that you need to be below the 10% mark. Maybe some people need to do that that are in a dire therapeutic need kind of a situation. But by and large, when it comes to diabetes, we want people to have a low-fat diet, animal products 0, but have the fats come from nuts and seeds, avocados. Not in large amounts. They're very nutritious foods. They're excellent. But use them in small amounts, maybe half a handful every day. Some nuts, walnuts, chia seeds, these kind of things. Flaxseed, excellent. Every morning. In my home, we will have 1 or 2 tablespoons of freshly ground flaxseed over our hot cereal. Excellent. So low fat, less than 20%, very low in saturated fat, which usually comes from animal products and cheese. And we don't want any trans fats, which you usually find in processed foods, right? No cholesterol, it's a vegetarian diet. High fiber, we want to see 30, 40, 50 grams of fiber. Fiber is your best friend, and the very best food for a diabetic to eat is to focus on beans, beans, beans. Oh, I know you worry about the social aspects. You don't have to worry about that. It settles down after 3-4 weeks. It will pass. Don't worry. It'll be okay. And then you have a diet here now that is very high in antioxidants. It's very high in phytochemicals. You have learned that there are probably over 100,000 phytochemicals in nature. They're all found only exclusively in plant foods. And they all have a special role to play in keeping our bodies, our enzyme systems working in optimal fashion. You follow this kind of a diet, you get maximum amount of phytochemicals. Exactly what you need. And then, of course, the density of calories is very, very low. You can eat as much as you want because you cannot overeat. Because the fiber, the roughage, prevents you from overeating calorically. Are you with me there? I mean, it's a wonderful thing of how this is all playing out very well together. And of course, you can reduce your food bill by 35 to 45%. Is that okay? Is that okay? I mean, that was a pretty meager response here. You can reduce your food bill by 35 to 45%. We guarantee that to you. Yes. But you have to move towards plant-based and less processed foods because that's where you spend your money. And you have to also think about eating more at home than eating out. And you can do it very easily. Just get a crock pot, get a slow cooker. It's easy to do, no problem. We'll teach you how to do it. Go to our website, CHIP Health, C-H-I-P.
What does CHIP stand for?
Health. CHIP stands, we recommend more potato chips, more... No, CHIP stands for Complete Health Improvement Program. And there are some 70,000 graduates all over the place, and the program is run in many, many cities by way of videos. Now, I should say, as we begin to close, the science is all there. What is not there is the political will. The science is incontrovertible that diabetes is largely a self-made disease that is culturally promoted. And the answer is not to put out more medications for the treatment of the symptoms in managing this disease. The answer has to be found in finding ways to provide energy to people, to give people hope, just like with Kathy. I don't think this is going to last. It's too good to be true. I've been on insulin all these years, and now all of a sudden, in just 4 weeks, I'm down from 32 units down to 7 units. Will this last? Yes, it will, as long as you follow through. Epidemiologists have long known that the major determinants of our killer diseases are dietary and lifestyle factors. Make your fork and your knife your friends. Use this fork and knife in the most effective way, because if you don't, they turn into weapons of mass destruction. So the greatest challenge that we have today in medicine is how do we motivate physicians to look beyond what they've been trained to do? To get into the concepts of lifestyle medicine, to look at nutrition and exercise and psychology and how to communicate with people, how to motivate people. And the other thing, of course, is the challenge before us is how do you motivate people to make changes? Because my colleagues said, well, nobody wants to change anyway, so I'm not going to waste my time. I've only 10 minutes to see a patient. There's nothing I can do in that. I can only prescribe the medication. Next one, please. We can change. But it takes more than 10 minutes. And part of that armamentarium is out there. Part of that is the CHIP program. It's a complete health improvement program. It's community-based. It's intensive education in groups. It's 12 weeks long, 18 sessions, 40 hours. Well documented. Just to give you a few data here, and we looked at some 525 diabetics. They were not on medication, but they were over 125 points, right? That's a diabetic. So there were 525. We did this study on 5,000 CHIP graduates. Okay, so this is not based on 5 people. This is well documented, and it's published in the American Journal of Cardiology. So there were 525 diabetics, and then look, within 30 days, there were no longer 525, but only 301 diabetics. So I asked a medical group in a large auditorium, I said, what do you think happened to these diabetics? They went from 525 to 301. And one deadpan, they died. No, they didn't die. They're no longer diabetics. But it seems to be so incomprehensible to many of my medical colleagues that you can actually stop diabetes in its tracks if you help people to change their diet and their lifestyle.